Good afternoon. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm the chair of the committee, and I'm joined today by Council Members Fry, Johnson, and Kano. We're expecting Council Member Bender any moment now, but Council Member Glidden is going to be gone for the duration of the committee for another event, but we do constitute a quorum of the committee. So I think we'll start. I think what I'm going to do, though, is before we go into our first public hearing and our only public hearing, I'd like to move through our agenda items, consent items, just in case there's some people here for those items. We have three consent items on our agenda. The first one is a landscaping consulting tree planting services item, authorizing execution of a contract with Tree Trust in an amount not to exceed $75,000 to provide landscaping consultation and tree planting services to interested businesses that pay an annual pollution control bill. The second consent item, number 3 on our agenda, is to authorize execution of an internship agreement with the Augsburg College Social Work Program and Bethel University Counseling Psychology Program to allow for the school-based clinic program to be a practicum training site for students enrolled in their graduate programs. And the third consent item that I'm going to pull for a staff direction is a tree remediation program. This is to authorize to contract with Wilson Custom Tree to increase their contract by $75,000 for the purpose of conducting a tree remediation program to address tornado damaged trees in the affected neighborhoods in North Minneapolis. I am going to pull that item, but on the first two consent items, I would like to move those unless someone else would like to pull them for questions or comment. Seeing none, then on items 2 and 3, all those in favor say aye.
Aye.
Any opposed? Those motions carry. On the third consent item on the tree remediation program, we got a letter from the Southside United Neighborhood Group. Many of those neighborhoods were involved in a big storm, you may recall. I think it was June 21st, 2013. A lot of trees were knocked over, so they were concerned about this funding going to North Minneapolis trees. I don't want to hold up the funding that was already been allocated to deal with the tornado damage, but I do think this raises an interesting point, and perhaps there's something we can also help do in those south side neighborhoods. So I'm going to move a staff direction. I'm going to direct Neighborhood and Community Relations and Regulatory Services staff to develop a recommendation for addressing removal of damaged trees and stumps on residential properties resulting from the June 21st, 2013 storm, and to come back with that recommendation to the committee sometime in July of this year. So what I think I'd like to do, and if anybody has any concerns or questions, you can let me know, but I'm going to move the staff recommendation to increase this contract with the Wilson Custom Tree, and with that staff direction then to get some more information about how we might respond to the south side neighborhoods. Hopefully that's clear for everybody. Any questions, comments? Councilmember Fry?
Yeah, before we move this segment, all of this money, for instance, this is, which item are we on here right now?
We're on the fourth item.
This is the fourth item, that's
Tree
what I thought. So
remediation
this is to increase contract with Wilson Custom Tree by $75,000 for the purpose of remediation to address neighborhoods affected in North Minneapolis. So this is predominantly to address neighborhoods impacted by the tornado. Does it also include neighborhoods impacted by emerald ash borer, or is it only for the tornado?
This is only for the tornado, and we can get a little staff report if we want, and if I'm wrong, somebody can correct me. But this is money we allocated several years back after the tornado. We have the money waiting to serve this need, but the contract wasn't this as large, so we're going to take money now, move it back into the contract because the work isn't done. But it's all about the tornado.
Okay, that makes sense. And this is not part of the click light item budget that we addressed last time involving
No,
tree.
and that'll come back later.
Okay, thank you.
Yep. Any other questions on that motion then and staff direction? Seeing none, all those in favor say aye.
Aye.
Any opposed? Any abstentions? That motion carries with that staff direction. And did you get that all right, Madam Clerk? Okay. Very good. Well, thanks everyone for your patience as we move through. We still have the public hearing to get through, and then there's 3 discussion items on our agenda. But first, I think I'd like to take up the public hearing. And I believe we have a staff report to kind of tell us what this is all about. Is Mr. Redlong going to tee this up, or Ms. Kish?
We're going to
A
co-present.
team. Okay, great. We like to see that. Breaking silos, interdepartmental effort, good coordination. Welcome so much, and why don't you give us a little presentation, and then if there's council members have any questions, we can take those, and then we'll open the public hearing.
All right, real quick, set up some displays here. I'm going to pull up the PowerPoint, please. And start from the beginning. All right. Thank you, everyone, for being here today, Mr. Chair and committee members. My name is Kelly Kish. I am the recycling coordinator in the Division of Solid Waste and Recycling, Department of Public Works here at the city. I will be giving the first part of the presentation, and then Josh will be following after that with additional information. So,
Wonderful.
So today we're going to go over a little bit of the ordinance history, why there was a need to look at modifying this ordinance, the proposed modifications, have a little discussion on polystyrene containers, the impact this will have to food establishments, how the ordinance will be enforced, and the penalties for noncompliance. Assistance available free and through grant programs here locally. And then how we will go about making sure that all parties are informed of the changes to this ordinance. So first of all, ordinance history. It was introduced in 1989. As you can see by the definition on the slide, that it was a very encompassing ordinance which made it slightly difficult to enforce and was really onerous and again, not feasible for enforcement. It was updated in 1996 to include more commonly recycled items, including glass bottles, tin cans, and aluminum cans. And an important thing to note here is that nursing homes and hospitals will be exempt from this ordinance as they are regulated by the state and not by the city. So why are we looking at changing this ordinance? Well, there's a city goal that the great places, natural and built spaces work together and our environment is protected. The current language is not horribly easy to understand. It also does not allow for compostable plastics, which, as you know, are being more and more frequently used by food establishments throughout the city, state, and country and world. And then there have been advancements in plastics recycling that make us or allow us to better select which ones are preferred for the region based on the recycling markets available. And the current ordinance for failure to comply results in a misdemeanor, whereas under the proposed changes, it would only be an administrative citation. So our current proposed modifications will expand the locations where who need to comply with this to include the mobile and the temporary vendors. So this will cover the events, which, as you all know, there is a requirement to recycle at events. They often have some difficulties getting some of the temporary vendors on board for them to have zero waste events. So this will hopefully help get the few items that would not have been environmentally acceptable packaging moved over to that material type. So this would include, for a grocery store, it would be the hot cases where the food is prepared for immediate consumption. However, in the instances of the produce counter where there's meat on polystyrene trays, that would all remain acceptable as is. The packaging now, the definition of packaging now includes more of the common items used both for events at home and at restaurants when you're getting to-go containers. However, it will not include items such as straws and stir sticks, as they are not necessarily a package. Also, silverware would be exempt as well.
Could I just ask one question?
Yep.
Because we got an email today from a volunteer group that provides meals to seniors.
Yep.
I'm not sure if you saw that email or if
Josh will be talking about that a little later on in
Well,
the
I'll
presentation.
just wait then. Okay, thank you.
Yes. So our environmentally acceptable packaging, at first it only was reusable, returnable, and recyclable, and again, we have added the compostable. Part of the current ordinance is that facilities must utilize a qualified recycling system, and we have added in that they must also use a qualified organics management system only if they are using compostable plastics, as it is less environmentally friendly to be using these and have them go in the landfill, and they're also a contaminant in the traditional recycling. So if they're using compostable plastics, they must also have an organics management system set up within the food establishment. We're going for an effective date as of Earth Day next year, which will give sufficient time to inform all people who will be affected about these changes and help work them through the steps to switching over some of their products. Environmentally preferable packaging, again, reusable or refillable. On the bottom there we see a dinner plate and usable silverware. On the right we see a new reusable to-go container that there is at least one, if not more, local restaurants looking at utilizing here in the near future. Then we have the recyclable and compostable packaging, which everything you see out here, this is a small sample of what I have back in my cubicle, but everything you see out here is recyclable or compostable, and the plastic items that are not compostable out here are all a number 1 or a number 5 plastic. So on the top, again, those are all recyclable, and on the bottom, that is all compostable items. And now I'm going to talk briefly about polystyrene containers. They are not commercially recyclable, reusable, or compostable here in Minnesota. Although some of the clamshells like this, or the ones in the last photo, can also be made out of polystyrene material, the markets here are not they're not strong enough, and it's not really economically viable for us to be starting to collect these in our traditional curbside recycling system or in another form at this time. If we were to ever move towards that, currently polystyrene, expanded polystyrene, and plastic bags are our top 2 contaminants that we're getting in the residential recycling program. And if we were to collect expanded polystyrene, it would have to be clean. We would have to ask residents to put it in a plastic bag and then in their cart. And so we're just asking for the top 2 contaminants to go in. It's not likely ever going to happen. So another issue with polystyrene is that unlike plastic or paper counterparts like these, when it gets out into the environment, it gets streets and waterways, and it's not going to break down. When it does break down, it breaks down into smaller pieces of plastic that are then ingested by fish, birds, and it'll continue up the food chain where it comes back potentially to us. And now I am going to pass it over to Josh, where he will continue the presentation.
Thank you. Chair Gordon, council members.
Welcome.
Styrene is reasonably anticipated to be a human carcinogen based on limited evidence of carcinogy from studies in humans, sufficient evidence of carcinogenicity from studies in experimental animals, and supporting data on mechanisms of carcinogenesis. This is from the Report on Carcinogens, 12th edition, the National Toxicology Program, Department of Health and Human Services. Also, styrene can migrate from the polystyrene containers into food and beverages when heated or when it comes in contact with fatty or acidic foods. So as a public health concern, why would we use this if there are inert materials available? San Francisco has reported their businesses have reported no complaints of financial burden. And as the demand increases for these types of products, we expect the initial cost for them to decrease. Many restaurants and grocery stores in Minneapolis already have recycling and composting stations like this, and they're finding that consumers more and more are demanding to be able to appropriately dispose of their waste. Hennepin County provides grant funding to help set up these stations, and reducing garbage is an opportunity to save money on taxes and fees, as there are no taxes and fees on recycling or organics, so they could save some money on their solid waste bill. Environmental health and business licensing staff have jurisdiction for this ordinance. Our primary goal as health inspectors is to act as consultants and educate business operators on the health code, and this is where most of our time is spent. We also have compliance meetings where business operators come in and meet with the inspector and supervisors and have a chance to dialogue each other's concerns. An administrative citation may be issued if there is still noncompliance. However, businesses have the right to an appeals hearing, a right to be heard by an outside arbitrator. We recognize the need to work with our business communities, and care was taken not to make this an undue burden. There are exemptions for packaging which is not environmentally acceptable, but for which there is no commercially available alternative. And Chair Gordon, this is where we can address people with real economic concerns. In determining requested exemptions, the Health Division will consider the availability of environmentally acceptable packaging for the affected products and the economic consequences to vendors of requiring these acceptable packaging when available, and also the competitive effects of manufacturers, suppliers, retailers, and other vendors involved in product brands or labels. So if, as far as the senior citizens are concerned, if they have a real issue coming up with that, there could be an exemption for them written into the ordinance. Our listserv is very comprehensive and growing all the time. We have one for short and seasonal food vendors. The other is for licensed food establishments. Right now we have over 2,700 businesses on our listserv, so we're able to communicate effectively with them. We will take time to consult with businesses about this change and to assist them with any issues. The need to minimize waste and increase recycling is something everyone who lives and works in our city can support. The Food, Lodging, and Pools Department is already actively engaged in the business community, meeting with various business groups regularly as partners and consultants. Our staff speaks at least 4 languages, and we have interpreters on call if necessary. Our focus as a department is one of education and consultation, investing one-on-one time with business operators to maximize the health and safety of their businesses, and we will introduce this ordinance in the same manner. Hennepin County is geared up to assist with free signs, collection setup, evaluations, promotions, education, and follow-up. I have some signs. Kelly has some signs here. Hennepin County grants could be used to purchase containers, help with hauling service charges, help with improvements to loading docks and waste enclosures. Also, the City of Minneapolis provides a number of different loan programs to help businesses start, stay, and grow in Minneapolis. In summary, the proposed ordinance is easier to understand, is less punitive, and expands the types of acceptable packaging to include compostable containers. Assistance is available to help businesses make the switch to environmentally acceptable packaging. Changes will help reduce solid waste generated and increase recycling, remove litter from our streets and waterways, and reduce contact with harmful chemicals. A win-win-win for the environment, residents, and consumers. And I'll take your questions.
Thank you very much for the report. I appreciate that. I don't see any questions right now. I see one question has come up. Councilmember Frye.
Thank you, Chair Gordon. I just have one question related to some of the outreach that you've done to specifically some of the small and local businesses. I really don't have a lot of concern for some of the big restaurateurs and large conglomerates that, they've got plenty of finances available to make a cut recovery anyway. But to the extent some of the small local mom and pop stores have a whole lot of styrofoam inventory on hand, have you checked? What have they said? Have you checked with them to make sure they're financially solvent?
Right. I'd like to ask Dan Huff to help with this question.
Good afternoon, Mr. Chair, council members. My name is Daniel Huff. I'm the Director of Environmental Health in the Minneapolis Health Department. Chair Gordon, Councilmember Frye, I think you ask an excellent question. How do we do the best outreach and engagement with especially our small business owners? And it is something that we continue to strive for and to do better. As Josh mentioned, we have set up various meetings with business groups within the city, different associations, business associations. We're working with community groups such as the Latino Economic Development Center to provide more consistent engagement, talking about all matters of the health code, from as simple as hand washing to new ordinances such as this. Any change is hard. That's why we want to propose, or we're proposing that the ordinance not be enacted until next year, give people time to go through their inventory, but also gear up for the changes, look for new suppliers. We are very fortunate in that in Minneapolis, we have our partner of Hennepin County, who has a lot of technical expertise, as well as grant funding available to provide our businesses. We in the health department are more than willing to sit down with our businesses, help them connect to those resources both within the city through CPED or our green business initiatives and through the county.
I just have one more follow-up question as well. And I realize that the difference in the cost probably changes on the size of the container and the quality of the container, but as a general rule, do you have a difference in cost between the styrofoam and perhaps an organic recyclable matter?
Through the chair, Councilmember Fry, I'm going to turn that to our Public Works folks and Solid Waste and Recycling. Okay.
Hello again, Ms. Gish.
Hello, Chair Gordon, Councilmember Fry. So you are correct. It does depend on the specific container, the quantity in which you're purchasing them. But to go from a expanded polystyrene foam cup over to a plastic cup, it's maybe 0.02 cents per individual piece. And then to go up to the compostable, it is a bit more expensive, or somewhere between 8 and 10 cents, depending on the item.
When you say 0.02 cents, you mean 2 cents?
Yes.
Okay.
Sorry. Yeah.
Thank you.
Yes.
Thank you very much. I don't see any other questions. We could comment after the public hearing. Might be the best time to comment, although I just was going to note that I'll forward you the information from the person who, and maybe you already have this too, I think it's Nancy Christensen who talked about it. And even at the end of her explanation, I just wanted to clarify, I wasn't necessarily saying we should create an exemption, and I wanted to understand if it applied to that kind of operation. It sounds like it does, because it's a food preparation operation, and so she even mentions that phasing this in would help, and she wants more information, so I appreciate that. And thank you so much for the great report and the PowerPoint. Very informative, and if we have more questions after the public hearing, if you're still available, we might call you back up.
Thank you.
Thank you so much. I'm going to open the public hearing then on this item, and there's it seems like maybe roughly 20 people have signed in to speak, so I'm going to go through the list in the order that folks signed in on. I'm going to ask people to please keep their comments to 2 minutes or under. That way we can get through the 20 people in a reasonable amount of time, and keeping it under 2 minutes would be beneficial. And is our procedure here to state your name and your address, and then begin your presentation. And first on my list is Jeff Fisher. Is Jeff still here? Could you come up to the microphone and introduce yourself with your name and address and give us your 2 minutes?
Yes, my name is Jeff Fisher. I'm a small business owner in Minneapolis. I own a cafe, and Firehouse Cafe has historically been on the forefront of recycling and composting and providing customers with information on how they can utilize some of their values through our business, and that we reflect those values of our customers by providing composting and sorting and using the use of environmentally friendly packaging. And what I found is that people really are engaged. They're very knowledgeable, much more than I thought. Coming into my business it wasn't much of a stretch to educate people on the importance and the detriment of some of the products that we've seen, and polystyrene being one of those. So it's something that's really easily for a consumer to get behind, that we carry those. And I think that as a value-based business, reflecting those values of our community is really important. Prices of compostable products, as we've found, have been very high, and it is something that is a challenge, but I'm seeing those prices come down, and hopefully with larger companies coming on board, that the purchasing power of some of our distribution centers here in Minneapolis, that the prices can come down to almost a negligible increase. That said, we have found some companies to provide those products, compostable corn-based silverware straws, plastic cups and lids that are all corn-based and compostable to be reasonable in price. Anyway, I just come out to support this ban on polystyrene because I think that it's a worthy thing to do.
Well, thank you very much.
Thank you.
Appreciate you being here. And that was right at 2 minutes. So if you're wondering what 2 minutes might look like while you're listening, that's what it looks like. Next on the list is Dan McElroy. Okay, listen. Welcome.
Good afternoon. My name is Dan McElroy. I'm Executive Vice President of the Minnesota Restaurant Association. Our offices are at 305 Roselawn in St. Paul. Thank you for the opportunity to share some ideas. Thank you to Councilmember Johnson for working with us on some changes. We have about 220 members in the city of Minneapolis that range from individual small coffee shops, small family restaurants, places like Curran's and Blackbird and Muddy Waters and a variety of others. And I have members in a group that large. We won't all be of one mind, and I have members who oppose any kind of mandate. But the consensus among our members has been that they're moving away from EPS or polystyrene or styrofoam foam containers because of guest preferences. And to the extent that the ordinance prohibits carryout containers and beverage cups, our members are generally supportive. Not unanimous, but a clear consensus. We have 4 concerns about the ordinance as it exists today. One is because it says all number 6 plastic, all polystyrene, is not environmentally responsible packaging. We're very concerned about some unintended consequences for things that may not yet be available, or where we'll have some disagreement perhaps with Daniel's department as to what's reusable or not. And so my key ask is, I think it would be wise to take a little more time to let us work with this, perhaps not advance it in this cycle. I think that definition of reusable may need some work. Secondly, we're concerned, and Kelly said in her remarks, that it would be required to have in dining room separation and composting if you use recyclable beverage containers. The ordinance says that you either have a recycling process and or organics management. And I don't see anything in the language that we've been given so far that has that exception for compostable cups and that would require dining room recycling, which for some is a challenge, will be interesting, challenging. Third, we're concerned about the effective date. As you know, the legislature passed a mandatory recycling bill last week that will be effective on January 1st, 2016, and for which definitions need to be developed. It was introduced by Representative Frank Hornstein from Minneapolis, and it says that commercial generators of 4 yards per week or more have to recycle 3 or more material classes from a short list, although the law says from this list but not limited to it. We're going to need rules to figure that out, and that's effective January 1st of 2016. We think there's a strong argument that the changes you may choose to make may benefit from aligning with that state law change. And so that April 22nd of 15 date means that we're going to have a gray area where complying both with your ordinance and state law might be more challenging. We're also, I have members who would like the opportunity to recycle more of these materials. And the recycling market is changing rapidly. And I heard the staff report that some plastics, styrenes particularly, number 6s, aren't economic to recycle today. We think that's changing fairly rapidly. I've talked to my counterparts in the states of Illinois and Michigan and New York, where instead of banning all styrene, they imposed a pilot process for recycling rigid polystyrene. And if those pilots aren't successful, they'll impose a ban generally a year following the start of the trial. So we think those are some options that might make this better. Bottom line for my members is we want to be good environmental citizens. We want to continue to work with the city of Minneapolis. We don't have an objection to just foam takeout containers or cups. We're concerned about rigid polystyrene, about the details of that recycling or composting requirement, the interaction with the new state law, and the opportunity to have a recycling pilot. Thank you very much.
Thank you very much. Next on my list is Ken Sesper. If I'm pronouncing that right. Welcome.
Thank you. My name is Ken Shelper, and I'm with Devani's. I've been with that company for 40 years and have kind of seen the whole question of polystyrene and that going back and forth over quite a number of years. There are, while alternatives, more alternatives have become available, and while they have become somewhat more cost competitive, there are, from the tests that we've done, still some significant advantages to what polystyrene foam does as opposed to the other materials, particularly in terms of holding foods hot and while preventing them from sogging out, from condensation, allowing steam to release and so forth. That being said, my understanding when this first was proposed, this ordinance change, was that the concerns were with foam containers, polystyrene foam containers, as opposed to extruded ones or hard plastic, if you will. Over the years, we have 23 operations in the Twin City metro area, 3 in Minneapolis, and people have talked about this becoming an issue for consumers and so on and so forth, and that's absolutely true. And while we have had occasional questions from consumers about our foam takeout containers for our hot hoagies primarily, we have never had one concern raised about the harder plastics, some of which I was surprised were number 6 until I started looking at them, and which are going to be difficult based on the information that I've gotten from various suppliers and that sort of stuff to find replacements for.
You could wrap up here, that would be good.
One in particular is this little item here. They actually go together. Oops, I'm sorry. There's a dome lid and a tray, and we use this in 2 ways. One for catering, desserts, hoagie party trays, things of that nature, where we use it in this fashion. And then we also use it for our large catering or group salads, and we have several different size containers, all with the same material, where this hard plastic bottom becomes a lid. This is a number 1. This, I was shocked, is a number 6. So, and I was just telling somebody, if you go to the church that I go to, where we bring in Devani's food occasionally and that sort of stuff and open up the cupboards, you will find probably a dozen of these types of things that they use and reuse to put out cookies that the kids bake to raise funds or whatever over time, because they make a nice display item. So I would simply echo some of the issues or the questions that Dan raised.
Your time is up, so if you could summarize very quickly,
Okay.
I'd appreciate it. Maybe you made your points.
Yeah,
and that's good
if the
too.
attempt is if the real objection is foam containers, then I think I would suggest that we focus on that and not these things that fall into the gray area.
Okay, thank you very much.
Thank you.
The next person is Holly Robbins.
Hi, I'm Holly Robbins. I live at 4715 Pillsbury, so I'm a Minneapolis taxpayer, concerned citizen. I'm also a small business owner. I have a small design firm that I run in Minneapolis. I'm a Wedge Co-op member of 20 years. I was also a representative to the Sustainable Packaging Coalition when I worked for Target, and I helped write their guidelines. And I also worked with buyers to help specify sustainable packaging. For example, we specified packaging like this. This was very early on, very pioneering at the time, early 2000s, where it was made out of PLA, so it was corn-based, compostable. At that point, there wasn't a compostable system in Minneapolis to put it into. Now it would actually be a perfect option to use in Minneapolis because you have now, we're investing all this money into a good recycling program and a good organics composting system, which, to put on my designer hat, I would call industrial ecology. So we're setting up a great closed-loop industrial ecology system, while polystyrene is a dead-end material. It isn't currently viable to put that into that system and have it work. So as a Minneapolis taxpayer, I'm thinking I'm putting all this money into an organics composting system. I don't really want to subsidize businesses anymore who don't want to work within the system that Minneapolis citizens have chosen as their preferred system. So if I'm having to give exemptions or not allow or allow people to continue to use polystyrene, to me, then I'm having to pay extra in my costs for waste management versus having everybody working on the same system and having a great cyclical system. And I think that's just a better way to go. In terms of cost, I understand that the cost is somewhat more expensive, but when it comes to things like this, and this is actually something I also teach at MCAD, I helped found a master's in sustainable design at MCAD. What we teach our students is you look for externalized costs. So currently, the businesses that are using polystyrene are externalizing their costs to society and to the environment and to Minneapolis taxpayers versus paying those costs themselves. To run a business in the society that we have, to work with the resources that we have, we need to be able to use these materials, and people who aren't doing that are, again, costing all of us more money. And I think it's time that we just take the plunge and make the move.
It's been 2 minutes now, so if you could wrap up,
Okay.
that'd be good.
Thanks. And then lastly, I want to point out that something that hasn't been mentioned yet is that polystyrene is currently made out of oil, which is a finite resource. So it's a dead-end material from that regard as well, and it's time we start using organics materials that can be sustained over the long term. Sooner or later, we're going to have to make the change. The sooner we make it, the more cost-effective it is. Thank you.
Thank you very much. The next person is Craig Johnson.
Hi, I'm Craig Johnson, and I'm a little nervous, but my background is sustainable design. I've been the former sustainability director for AIJ Minnesota, which is the third largest design organization in the country. I also am a master's student working towards sustainable design as a degree. I'll try not to repeat a lot of the things people already said, but basically I think when you talk about polystyrene, you have to think of it as within a system. The city of Minneapolis is working on a certain system, and really what you want to do is introduce things, especially things that are one-time use, into that system that makes sense. A lot of people have a misconception that recycling tends to be across the board good when you attach the word recycling to it, but not all things that are recyclable are actually necessarily the best solution. Some things that are recyclable take a lot of energy to recycle those things, and in the end they become what we call downcycled. So they become something that, let's say, instead of a piece of wood that is very functional and works well, it becomes a piece of something else that is less preferable and maybe actually breaks down into something that is harder to collect in the end and ends up in our waste stream in an unintended way. I think with polystyrene, you have to look at the whole system and how it reacts to the Minneapolis system. The extraction methods are probably not preferable. There's a lot of things that go back to a petroleum product that, again, like Holly said, are finite, but also I think in the end of life, even if you look at the recycling rate that you'll probably end up with, if you do make it recycling, and if you ignore the energy cost and the cleaning that it will take to make it actually a viable product for something else that might actually be downcycled, you're looking at something that, if you look at PET, let's say, which is already a pretty established product in the recycling stream, it's collected by most municipalities. A lot of people come into the city of Minneapolis and they leave with their food. So what you're doing is you're allowing them to leave with polystyrene and actually bring it to a community that probably won't have that recycling program. And when you could make it into another thing like a 1 or a 2 or something that's compostable, which is less harmful, which basically in the end means that if they bring it to an outlying community, there's a pretty good chance that they have a 1 or 2 recycling program.
Do you have any other final points?
Just that even with PET, which is a much more preferred recycled material, it's a lower rate. Let's say 30% nationally is the best they say. So even if you do make this recycled, you'll probably still get 60% going into the trash anyway. So it doesn't solve the problem. Thanks.
Thank you. Next person on the list is William, and it looks like Mark.
I no longer have a comment. Thank you.
Okay, thank you. Nora,
Norby.
maybe you can tell us your last name and your address.
Norby. And
Thank you.
I have a company at 1620 Central Avenue Northeast, and I live in Uptown and have lived there all of my life. I am supporting the use of recyclable and compostable takeout containers for restaurants. I just want to show you something that my company makes because we've been into recycling for many years. These plastic bottles that most of us recognize and, we get our water and soda out of, 10 of these make enough fabric to make 1 of these, and these are washable. So many to-go containers get put in plastic bags that get thrown away. The average American uses now 1,500 plastic bags a year. We're suggesting that people use both for their groceries, but for takeout, a recyclable bag that's washable. Our bags are washable in hot water. And the best part about them is when they wear out, which is after many, many years, they can go back to the mill and be recycled again. They're completely sustainable. You can't say that for very many bags that are out on the market, and so I encourage people to take their own bags to the restaurant and stop using the plastic bags. Thank you.
Well, thank you very much. And Allison LeBone?
Hi,
Welcome.
I just became interested in polystyrene like 10 years ago just as a consumer, and have watched kind of the change in public perception of it. And I know that it's time for restaurants to make a change because I'm glad to hear that people from restaurant associations, people who work at restaurants are hearing this feedback from consumers. I personally stopped getting takeout food from restaurants that use polystyrene to-go containers maybe 10 years ago, and I know the history, going back a little bit, like McDonald's was going to do a nationwide polystyrene recycling program, but when they did their marketing research, they discovered that the public opinion of it was so low that it didn't make any sense for them to invest a lot of money in a program that would link them to polystyrene. And so I just, for all the people involved in cafes and restaurants here today, I just want to say that, I think that they probably had pretty good market researchers. You're hearing the feedback, and I think that people should be changing whether or not this ban takes place, but I'm totally in favor of the ban. It's time. I mean, I've done research about the alternatives. There are alternatives that are just as cheap. A lot of times people can be creative and take the volume of their like you want to reduce the volume of the packaging. Sometimes a hoagie can be wrapped in a piece of paper, and that's cheaper than polystyrene, and it's so much better. And this ban will help us move in the direction that we need to go, and that's what consumers want too. So, thanks.
Thank you very much. Next person is Russ Snyder.
Hello, thank you for the opportunity, Mr. Chair and council members. My name is Russ Snyder. I work for Genpack. We're a manufacturer of a wide range of quality-made food service products, including polystyrene foam. We have about 150 employees at a manufacturing plant in Lakeville, just down the road, Lakeville, Minnesota. We believe there are many strong reasons to reconsider acting, or at least acting quickly, on a ban on polystyrene foam. A ban is fairly drastic. It won't eliminate waste, and the waste stream will be replaced by another form of packaging. What it may do is truly take away the choices or input on food container preferences. It also takes away the possibilities to recycle polystyrene materials. We'd like to engage, and we oppose this ban. We strongly support recycling, and we'd like the opportunity to engage with you, with local recyclers, to participate in looking at the kinds of successes that have taken place and are reality in places like Illinois, California, and New York. Thank you very much.
Thank you very much for being here. Next person is Riz Prakasyan.
My name is Riz Prakasam, and I represent Gandhi Mahal Restaurant. Together, we strongly support the polystyrene ban. We'll tell you that we opened up in 2008, and our intention was to only be a great Indian cuisine restaurant. However, we found our consumer base to be highly educated, and they, in fact, challenged us to go green. And incrementally, we began that process to get rid of polystyrene and other non-recyclable and non-compostable containers. And I can tell you, having undergone that process, it is not very difficult to do at all. I, for one, am glad to be part of a restaurant that values our collective environment. And even though we have to pay a couple cents more for these containers, we believe that we're absolutely doing the right thing, and that we are not unnecessarily adding to the waste stream. So we strongly advocate this ban.
Thank you very much. Thanks for being here. Next is Daryl Gerber. Welcome.
Thank you, Chair Gordon and members of the committee. My name is Daryl Gerber. I'm at 3733 Pillsbury Avenue, and I'm also the program coordinator at Clean Water Action, which has had an office in Northeast Minneapolis since the mid-90s and has over 40,000 members in Minnesota. And I come here today to offer our support of Clean Water Action for the environmentally acceptable package ordinance. So the ordinance, as was mentioned in the staff report, does support the new City of Minneapolis's goals, but it also helps the city meet several sustainability indicators, in particular the waste reduction and recycling indicator and the healthy lakes, streams, and rivers indicators. The EPS foam is lightweight, has been pointed out, and breaks down easily, and also flies around to escaping the litter and recycling collection, is also mistaken for food by the wildlife, and so they eat it. And it also doesn't break down. It only just gets into smaller and smaller pieces. And in fact, the plastic polymers are designed to be durable, and no research has shown that plastic ever disappears from the environment. EPS is also made from styrene, which the federal government has determined is reasonably anticipated to be a human carcinogen. And styrene does migrate from the containers into the food and beverages. And according to the US EPA, 100% of Americans have styrene in their bodies. EPS foam also has an astoundingly low recycling rate, and the American Chemistry Council has taken the position that the cost of collecting, cleaning, and recycling post-consumer EPS is greater than the value of the recycled product. And also, EPS foam comprises a significant portion of the street and highway litter in which the city and residents spend considerable time and money to collect and control. None of the litter collection or trash capture methods effectively capture small, lightweight pieces of foam before they reach our waters. EPS foam is also incorrectly placed into our recycling in our households, which requires removal of those pieces and increasing the cost of our recycling programs. Luckily, there are affordable and functional alternatives, and price differences are usually only pennies, and this, coupled with the tax breaks for recycling and grant programs, should substantially minimize or eliminate the financial burden on our local businesses. And for these reasons, Clean Water Action asks for your support of the environmentally acceptable package ordinance. Thank you.
Thank you very much. Next is Tim Brunell. Welcome.
Thank you. Thank you, committee members. My name is Tim Brownell. I'm the co-president, executive director, and chief executive officer of Eureka Recycling, based here in Minneapolis. We're a zero-waste nonprofit organization, and we are here in strong support of the amendment to the ordinance and the ban on polystyrene. Much of the health impacts have been spoken to, not only with food contact, but there's also the health impacts relative to the disposal of the items, the process by which they break down. Do not break down in landfills. There are the impacts when burned of the styrene. So there are several human health concerns. But Eureka is also a service provider. We provide zero-waste services here in the metropolitan area. In Minneapolis, we're providing composting and recycling services to over 50 businesses and farmers markets. We do zero-waste events. In all of these participating areas, the zero-waste events, which are block parties in neighborhoods to as large as the Rock the Garden event, we're working with vendors who enthusiastically embrace the compostable and recyclable materials that allow for the recovery of over 90% of the waste stream at these events, these restaurants, these farmers markets. We are strongly in favor in that what this ban and the requirement for recyclable materials and compostable materials will really assist the city as it's moving towards its zero waste goals that it's stating, in that these containers can then be vehicles by which food waste can be composted. The majority of these materials are ending up in residential households. They're coming from restaurants, they're moving to households, and those households are the ones who are faced with the burden of what do we do with those. As a recycling facility operator, we can attest to the fact that these materials are not recoverable through our stream. We do not have active, viable markets by which we can sell polystyrene. But even more importantly, in the residential programs, trying to pull that material out is very difficult. In most cases, that material will break up through the collection and processing process and create smaller and smaller pieces that are impossible for us to remove. So with that, we strongly urge your support, and thank you for your consideration.
Thank you very much. Appreciate you being here and sharing your perspective. Next is Anne Marie Treglia. Welcome.
Thank you. Thank you for having us. My name is Anne Marie Treglia. I'm the Global Manager for Dart Container Corporation. We are one of the largest manufacturers in the world of foam food service containers. We also make a variety of compostable, paper, and other plastics. There's pros and cons to all the materials. I could speak in volume, but I won't, on all the different options that work with compostables or non-compostables. There's a lot of misperceptions, too, regarding styrene and polystyrene. I think the fact that there's styrene in the name of polystyrene, people assume they're the same thing. Styrene's an actual liquid that has a very sweet flavor and smell to it. The FDA, so the Food and Drug Administration in the United States, allows it as a direct food additive for flavoring, direct styrene, not polystyrene, direct styrene. So it's naturally also occurring in the foods we eat. If you ever had beer, cinnamon, beef, you're naturally ingesting this. I mean, you could pick your strawberry right out of the field and never have it touch anything, and you're still getting styrene. So when they say there's 100% of tissue sample, it's because it's naturally occurring, plus the exhaust from cars is a big carrier of styrene. So polystyrene is also permitted by the FDA for food contact use and has been for over 50 years. There's never been a case of anyone being sick from it. One of the things I would urge too is the recycling of foam. DART began in 1990 recycling foam food service containers clean and dirty. You can do it with either or because it's a thermoplastic, so it just melts right back down. This, I'll just show, is a picture frame that's made from 100% of foam that's been recycled. You're free to look at it. These are some of the processes that foam can be made into. Again, I would just encourage the city to consider if recycling would be a better option versus taking away your consumers' choices and allow them to have an opportunity to try out recycling. And if you feel it doesn't work, then you can also pursue a ban. Thank you.
Thank you very much. Next person is Mark Snyder. Well, followed by Edna. So if you two would like to do it together, that's fine.
I'm Mark Snyder. I'm a volunteer with Sierra Club's Clean Air and Renewable Energy Committee. And
I'm Edna Brzaitis at 4 Grove Street, and I'm appearing today as a member of the Sierra Club North Star chapter to convey the chapter's support for the proposed ordinance. Does this overhead work?
Yes, if you
Okay,
set
good.
something
Okay.
down, we'll have to do a little
Yeah.
switching, but you can
Okay.
show that.
Okay. Passing this ban throughout Minneapolis allows for less waste today and the potential for more sustainable choices in the future. It is just not sustainable to use disposable polystyrene foam food and beverage containers. Recycling this material is difficult and expensive, and when littered, it crumbles into small pieces that are difficult to clean up and can be harmful to wildlife. And to show this, this is the Mississippi River. And all the white pieces all throughout this are floating pieces of polystyrene foam. They look like this. It is immortal. It is coming down through our storm sewers, into our creeks, our lakes, and our rivers. And there is not the momentum to recycle it that has been asked. So polystyrene also proposes health risks. Styrene is a carcinogen and reproductive toxin, and chemicals can leach into hot food and beverages. There are safer and more sustainable options available for composting or recycling that are well suited for the city's zero waste goal. This ban would provide a strong start through the city's goals, and we urge you to implement further environmental measures that promote both equity and sustainability in our community, such as implementation of the Climate Action Plan's comprehensive vision to reduce citywide greenhouse gas emissions 80% by 2050, doubling regional transit ridership and supporting safe, walkable neighborhoods, aggressively implementing a safe, accessible bikeway for everyone network, coming to a strong franchise agreement with Excel and Centerpoint Energy, moving towards zero waste by implementing citywide curbside organics recycling. Actions like this would demonstrate that the city is committed to meeting its goals and helps Minneapolis make progress on its mission to become cleaner, safer, and more sustainable, and will add to our city's great list of distinctive characteristics that make it more attractive for new residents and visitors. We urge you to support the polystyrene foam ban and future environmental measures for our health, for our environment, and for Minneapolis residents. Thank you for your work to reduce our city's climate impact and to prevent this, which is also found today by the river. Thank you very much.
Thank you very much. Thank you for being here.
Just out of my yard. I'm not sure where exactly it blew from, possibly from the park across the street. There's no restaurants or any other facilities like the ones mentioned here that anywhere around me, so it traveled pretty far.
Yes, okay.
Thank you both for being here. We have three more speakers. Mike Levy, and maybe while Mike is coming up, Trevor Russell is next, and then Carrie is last.
Thank you, Mr. Chairman and members of the committee. My name is Mike Levy, and I represent the Plastics Food Service Packaging Group, which are members who make all kinds of plastics food service, and many of them make compostables and degradables as well. I've asked my colleague to provide detailed kind of briefing packets, and the reason being is you heard a lot of information about safety, health, recycling, degradability, litter, what happens in landfills, and we've done a lot of research on that too as well. And I'm going to touch on some of these subjects, but I've left this information for you, and hopefully you'll be able to basically take a look. The bottom line is that we think that our products, not only polystyrene foam, but number 6, number 5, a lot of the other plastics are in fact environmentally acceptable. And I heard many speakers today talk about looking at the whole big picture approach, and we agree. In fact, studies that have been done that look at the life cycle of a product from cradle to grave, raw material, when they've looked at food service, they looked at foam and paperboard and PLA, and they actually show that because polystyrene is 95% air, it generates less energy, significantly less water usage, up to 4 times than PLA products, but also it creates a lot less solid waste, both on weight and volume. So you think, well, what about the end of life? And that's why I believe that we hope to work with the city to show that polystyrene foam actually is recycled. It's the most recycled of all the food service. When you think in terms of recycling, remember we're talking about takeout packaging, whether it's a coated paperboard or compostable or foam or something else. Cities like New York, DC, Baltimore, Philly, Boston, LA have all looked at the same subject like you have. They started out by looking at bans, and many of them over time have taken a hard look at, can we add polystyrene to the recycling stream? In answer to some people that said, are there markets? Yes, there are markets. There are 65 cities in California over the last 10 years that are recycling foam containers as well as foam protective packaging. They're making it into picture frames that you just saw there. They're making it into business office supplies, nursery trays, things like that. But I want to also touch on what I heard on the safety.
If you could wrap it up quickly, because your 2 minutes is over.
Okay. Just a final thought here. First of all, we are very interested in working with the city on adding that, maybe doing a demonstration pilot on what we've learned. And then my final remarks are on our members are very, follow the FTC Green Guides. And what I would advise all of you is when you hear terms like recyclable, compostable, and degradable, the FTC has specific guides. You have to have infrastructure share to do that. We're all for composting. We're all for recycling. But unless you have an infrastructure built in, you can't really call those products, and they're cracking down. So I would say let's all work together to do that. So thank you.
Thank you for being here. Trevor Russell is next.
Greetings, Mr. Chair, council members. My name is Trevor Russell. I'm the Water Program Director with Friends of the Mississippi River. We're a nonprofit organization based here in the Twin Cities with a mission to protect and restore the Mississippi. Starting in 1980s, Minneapolis, St. Paul, and other suburbs separated our sanitary sewers from our storm sewers. Why'd we do that? Because in big rainfall events and snowmelt events, a single system would overflow and discharge raw sewage into the Mississippi River and our surface waters. As a result, we have separate systems now, storm sewer and sanitary sewer. That works great on the wastewater side. On the stormwater side, every curb in Minneapolis is now waterfront property, whether we like it or not, because every raindrop that leaves that curb flows directly through storm sewers, untreated, into our surface waters. Thus, addressing trash and litter in our streets is of vital importance to water quality. A California study indicated that about 2/3 of street litter is food and beverage packaging, a huge area of importance for clean water. In particular, EPS containers clog storm drains and create risk, break into small pieces that fish eat, clog their digestive systems. These materials, as it's been noted, Edna, thank you, float and are white and are gross and impair recreation and tarnish our shorelines. They are durable in our environment. They leach toxins into our environment. They are unnecessary. They are unsustainable. And it's frankly time for them to go. For these reasons and for reasons associated with clean air, habitat protection, and global sustainability around the use of petrochemicals to derive a variety of non-compostable food packaging, our organization strongly endorses this initiative. I'd also like to address some of the economic aspects of styrofoam. We've heard that maybe 2 cents on a package of Chinese takeout is somehow going to economically imperil our city. Here's the real economics of styrofoam. We're competing with Seattle and Portland and LA and San Francisco and Denver and Chicago and New York for talent, for bright, young, innovative people that want to move to our city, put down roots, invest in our neighborhoods, and make our city great, as you have all done. We're competing with those cities, and that talent is going to be attracted to the kind of cities that have the values that say we're sustainable, we care about our future, we want to do what's right for the next generation. We're competing for that talent with those other cities that are miles ahead of us on sustainability initiatives. If we're going to catch up, if we're going to succeed, if we're going to be the kind of city that Minneapolis deserves to be, I believe we need to take serious steps forward in sustainability initiatives just like this. That's the economics of styrofoam. I urge you to take that into consideration and please advance this policy today. Thank you.
Thank you very much. The last speaker who signed up is Carrie Shanahan. Welcome.
Hi, Carrie Shanahan, 4449 15th Avenue South. I just wanted to come as a citizen, and I work in advertising. I do editing for TV commercials. We end up ordering lunch like every day, as most ad agencies do, the entire place. We tend to stop ordering from places that use polystyrene, but you still, can't avoid at the end of the day, there's a mound of it sitting there going into the garbage. So my friends and I had been ready to do a petition, and luckily this came up instead. So I just wanted to, voice, and I love what the last speaker said about, I think it's true, I feel like we're behind. I moved here 10 years ago from New York and felt like it was a very progressive city, and it's been questionable, I think, that it's taken us this long to even be here. So,
Thank you very much for coming in. That's the last of the people who signed up there. If you feel there's something that was left out and you came here really anxious to speak and didn't get to sign up, I'd like to afford you that opportunity. But looks like we have one more person who'd like to speak. Come up and introduce yourself, please, and tell us your name and address.
Chair, Carolyn Miller. I think I did sign up. I don't know whether you missed me.
Oh, sorry about that.
I represent businesses in the Twin Cities. Councilmember Fry, just an answer, just for us, we're familiar. We'd be looking at a 169% increase for the products that we would be using for our takeout. Not so much with where I'm at, but with our pizza in Uptown, we'd be looking at a 30% increase, which is significant. I dislike the fact that this is regionally, it puts us Minneapolis, that we're incurring costs as businesses, that St. Louis Park, businesses directly across the line that we are in competition with, will not be seeing. So, we would have to increase prices where they necessarily would not. So I appreciate the fact that going regionally, once we get out and we go to the state law, would be a much better situation, I think, for the businesses in Minneapolis.
Thank you very much, and sorry I didn't call you the first time. Seeing nobody else, okay, one more comment? Please state your name and address for the record.
Yeah, name is Lee Samuelson, and address is 2836 18th Avenue South. I just wanted to say I was fully and greatly in support of the council taking initiative and leadership on this issue of toward banning styrofoam, and it'll help people stop and think quite a bit. And in general, I see moving towards zero waste is a great source of jobs for the city. Just like there's no throwaway items, there's no throwaway people, and I do see that. One thing I would like to am interested in knowing about is if there are any hard number goals like 80% reduction by in 8 years. That was one area I could see for improvement if that could be quantified. And it is. I did notice that, and it's really great to see the city had had greatly expanded the amount of items that could be recycled, and it was quite interesting to see that, and quite ironic that it was an old ordinance from past in 1990 was one of the things on the new recycling list. So I'd like to thank you for this opportunity.
Thank you so much for being here. With that, I'm prepared to close the public hearing if everybody else is willing to go along with me. All right, public hearing is closed then. And council members, do we have a motion anyone would like to make? Or discussion, questions? Councilmember Johnson.
Mr. Chair, I'll move that we support this ordinance change and move it forward.
All right, thank you very much. And is there discussion on that motion? Councilmember Fry?
Thank you, Chair Gordon. And I would also first like to applaud Councilmember Johnson's effort on this topic. Very clearly, there is some need for more environmentally sustainable packaging and sort of bringing a lot of our restaurants forward here. I sincerely appreciate it. I just have a couple of questions / concerns that either staff and or you, I think, could help answer. I know we've already been through the staff presentation, but through the course of questions, I just want to make sure we're on the same page here. The first has to do with Section 5, 204.50 Rules and Regulations. And I'll just read you this section here. It says, the Environmental Health Division may, upon notice and hearing, promulgate such rules and regulations as may be necessary to carry out the purposes of this chapter and protect the health of the public, including the development of exemptions under Section 204.70, which I don't see right now, for packaging for which there is no commercially available alternative. My concern is with the commercially available alternative. You know, with globalization and everything that goes on in our world now, there pretty much is a commercially available alternative to almost anything. But and this is a bizarre example, I know, but I'm just, looking ahead to maybe some really weird type of beer that you can only handle in a certain kind of cup here, and that certain kind of cup perhaps is not recyclable. But perhaps there's some city somewhere in Asia that builds a lot of material for NASA, and they have a commercially available alternative, but it costs $5,000 a pop. Clearly, that's not a reasonable commercial alternative, but it is nonetheless a commercial alternative. Does either Councilmember Johnson or staff care to comment on how this would be carried out by staff?
Councilmember Johnson, did you want to respond, or perhaps Mr. Huff?
Do you want to take this, Dan?
Chair Gordon, Councilmember Fry, I think it's you use the word reasonable,
yeah.
And staff, whenever we interpret your direction through an ordinance, it's always looking through the lens of reasonable. So I would say that something that is sold to NASA for $5,000 would not be a reasonable commercial alternative for a local brewer or a local business. I think that we always look at reasonableness. So I don't know if that answers your question, but it's obviously staff interpretation is important. It's why we hire very smart, talented people and to make those sort of judgments.
Thank you. So I guess in response to, unless Councilmember Johnson has anything further to say, in response to that, I would move to amend simply to add the word reasonable in front of commercially available alternative in 204.50. So it was saying there's no reasonable commercially available alternative.
And also, might I suggest we strike the under section 204.70 in your amendment?
I'm not, so I'm not sure if section 204.70 was going to be added by staff later, or if it's just not there permanently. So if it's not there permanently, then of course we'd strike it.
I think we have to change.
I'm sorry, Councilmember Frey.
You may have to change 204.8 to 204.7, I think is probably what happened. But
okay.
Is that?
Well, because that was not being amended, that was not part of the amended ordinance. So this is part of the current ordinance, the 204.70 exemptions.
Oh, I see. So that exists somewhere else, we just don't have it here.
Yes.
Okay.
Okay, gotcha.
So let's take it then that we have just made an amendment to add the word reasonably then between no and commercially available, and see if there's any discussion on that amendment. I don't see any discussion. All those in favor say aye.
Aye.
Any opposed? Okay, that motion carries. Now we have the amended ordinance before us. Are there any other amendments or any other comments? Councilmember Johnson.
Thank you, Mr. Chair. I was very happy to see all the support today for this ordinance. You know, to give you a little context in the history, I've been going through the ordinances as a small business owner myself and concerned about how they impact us and whether or not they're clearly written, whether or not they're easy to understand and follow. And so going through it, I saw this ordinance and I said, does this mean that polystyrene containers are banned? And so I reached out to our health department, who has just been fabulous. Thank you so much for all your work. And they looked at this and they said, you know, there's an opportunity here to really update this ordinance, modernize it for our businesses, standardize the language, and allow things such as compostable containers to be used. And they looked into the history and they said, you know, currently under this existing ordinance, these polystyrene containers are not legal in our city. So this is an existing ban on these containers. And granted, it wasn't consistently enforced over the years, but we've corrected some of those problems in other areas as well. But it's an existing ban already on these containers. But right now, under the current ordinance, we have businesses that are in good conscience utilizing compostable containers that are illegal under this ordinance as it stands. So I see this as a huge opportunity to really step up, modernize this language, reduce the penalty for businesses, and ultimately make it more environmentally friendly. And it's very exciting to see restaurants step up and tell us about how their customers are expecting this, how the industry's changing. It's exciting to see Hennepin County step up and offer resources to our small businesses to help with this, to help them be more environmentally friendly. It's great to hear from restaurants who have gone through this that this is not difficult at all. It's great to hear from our recycling partners that this is a change that they're excited about and can get behind. And when we talk about prices, I think that's a key thing that we've thought about for businesses. You know, obviously, it's something we want to think about anytime there's a potential impact to the price of our business. But something I continually remind myself about this is that there is a price that we're paying. There is a cost to us all for these packages. We're paying for it, even if you never use polystyrene containers, to have these containers pulled out of our recycling stream. You're paying for it when our storm drains get clogged, and then we have to send crews out and have to clean it out. You're paying for it in terms of environmental litter costs and cleanup. You're paying for it in so many different ways. And in fact, with the health effects as well, granted, these are low levels of styrene in the container, but there's also other chemicals as well that can leach out into our food. And so we have to ask, is that fair for a business which, you know, knowing my restaurants in the neighborhood, they are very proud of the products they make and the food that they make. And they don't want their food products adulterated with toxic chemicals. They want people to enjoy it and to have inert containers, which they can reasonably expect are not going to have a negative impact for everyone else. And so that's what we're talking about here, is really an ordinance that is being updated and brought up to speed and is ultimately going to be friendlier for businesses in the long haul. Thank you.
Councilmember Cano.
Thank you, Mr. Chair. First of all, I wanted to thank you, Councilmember Andrew Johnson and Chair Gordon for moving this forward, and thank you for bringing this up. Obviously, we as a city are moving towards a zero waste approach. It's no secret that the mayor's office has put this as one of her priorities. We as a council also support this work, so I'm glad to see this happening. I did just want to share that I feel like a lot of these initiatives really rest on the success of these initiatives and the inclusion of people of color and immigrant folks in these conversations and in these very important initiatives really rest on how we engage communities of color and how we help them to close the information gap and the education and awareness gap. So I see members here from Latino Economic Development Center who have been working on these issues on the ground, and I'm excited to keep working with you and with my council colleagues to make sure that these initiatives are fully embraced by all sectors, all business sectors in our city. And I did meet with the staff, with Mr. Huff, and we talked a lot about ways that we can align our city resources to ensure that we are sharing information in a very effective and engaging multilingual approach, that these types of efforts are supported by the organization above and beyond what's written in our books and in our ordinances. So I just wanted to bring that up to our attention, because we're going to need to continue to do the work to ensure that when we launch these efforts next year for Earth Day, that we have a full participation from all community members, and that folks who need to make that adjustment, not just in their awareness and understanding of the issue, but also in the community way, right? How does this look in the community? How do we attract more clients to these businesses, to these small immigrant-owned businesses, when we do, offer living wage jobs, like Councilmember Jacob Fry's, one of his businesses in his ward has done, one of the pizza places. And so how do we help businesses understand that by changing their practices and by being more socially responsible, we're actually creating better communities and attracting more clients and a diversity of a customer base. So thank you again for working on this, and I'm looking forward to continuing to help this be a success.
Thank you very much. Councilmember Bender.
Thank you, Mr. Chair. I just want to thank everyone for coming today, and especially the business owners who have gotten involved in this conversation. I think it's very likely and logical that business owners would pass the small cost on to their consumers. And I think that we'll see that people are willing to pay the premium. It obviously it's a very small cost to each individual consumer. And so I think the health benefits, and I think some of that image issue that some of the speakers brought up are really important to our city. To show that we care about the environment, that we are supportive of people's health, that those are important messages for all of us to send together. And I'm glad that the business community has been engaged in this as a partner in drafting this ordinance. So I will support it. I was a little cognizant of some of the questions that were raised about, for example, the timeline for implementation, but it sounds like Councilmember Johnson has been speaking with the business community about that, and that there is a lot of time here to implement this. So thanks.
Thank you very much. Councilmember Fry.
Thank you, Chair Gordon. What we've noticed, I think, in just the first 5 months here is anytime you have a action, there is an opposite reaction. So it's important that we're cognizant about both sides of this, regardless of how environmentally conscious we are here. And on the opposite side, I think it's very important that moving forward here in the coming months and year, that city staff are really working directly with the business community and these restaurateurs, because if the restaurateur is experiencing a 30% jump in their costs, whereas we're under the impression that it's a 1 or 2 cent increase, that's, I think, kind of a big difference. So perhaps we have some information at our fingertips that they don't have. So I would ask direct city staff to please continue that collaboration with the restaurant community, because that's incredibly important, and we already know that there are restrictions that are inhibiting them a bit. I looking through the emails, I saw there was one item regarding coffee cup lids, which I think is a number 6 right now, but that would probably be a number 6 that would have fallen into the not reasonably commercial viable alternative. And I see you nodding, so let the record show that they're nodding there. I think that's good. And that being said, with those precautions, I'm very excited about this ordinance, and will be supportive.
Thank you very much. I'm also very supportive, and I also really appreciate everybody coming down here. I thought it was interesting that the Restaurant Association pretty much had consensus supporting this as well. I think that maybe what we're hearing now is a little challenge to some of the container manufacturers and DART. We need a different kind of lid for those coffee cups. We need another kind of lid for that pizza box, and let's get going on that. I think clearly what we really want is to reduce the waste in our city, to make it a more sustainable place, and we see key to that, just a big key is packaging. And if it's not easily, and I would say not too much downcycled, but if it's easily recycled or upcycled or level cycled, that's what we really want. We don't want things that then we're calling it recycled and it's really just creating more problems later that we're kind of, and even inventing products that we don't need and those kinds of things. So I really appreciated a lot of the comments and everybody came in, and also the fact that we had businesses with environmentalists standing up and saying we want this to move forward. I appreciate that. And it's always fun and interesting. This is my third term, and there's some other first-termers here, and it's fun to see what first thing they decide to try and move forward on. And I just commend Andrew Johnson for taking this on. It wasn't without controversy, and I think it bodes well. I expect there'll be a lot of good things to come in the future. And with that, I'll call for the vote. All those in favor say aye.
Aye.
Any opposed? All right, well, that carries, and that will move forward to the full council with a recommendation. So there's a... And I really appreciate folks who've been waiting for their items through all of that. I hope it was interesting. The meeting is not done. We're just getting started. We still have 3 discussion items yet to go. You might want to run and refill your water containers or whatever, but we need all of us for, I guess we don't. So we've got the meeting though, but you guys can talk later. Our next item is our presentation on the youth tobacco issues and a report from the Youth Congress. So I'll ask everybody to continue this energy and discussion, but take it out in the hall if you're on our last item so we can move forward. Oh, look at how nicely they did that. If somebody left a flash drive up here, it's probably Kelly's. Okay. Well, we'll get it back to her later. I'm still optimistic we might wrap up by 3:30, but not quite as optimistic as I was when we started. Ms. Pratt, are you ready?
I am ready.
All right, here we go.
You need a break?
Welcome. We're okay.
Thank you. My name is Laura Pratt, and I'm here with the Minneapolis Health Department to talk about tobacco, specifically youth tobacco. So tobacco use is still a problem. It just looks a little bit different than it used to. We have new products that are emerging to compete with cigarettes, to complement cigarettes, if you will. We have different practices that different immigrant groups bring from their communities, but it all leads up to the same deadly problem that tobacco use causes, the chronic diseases, the premature death. In fact, tobacco use is the leading cause of preventable illness and death in this country. The good news is that Minneapolis has some of the lowest tobacco use rates in the state and even the country. Our overall adult smoking rate is at 16%, but similar to other health problems in our city, it varies greatly by geography and different race and cultural groups. So for example, in Calhoun Isles, there's a 13% adult smoking rate compared to 24% in Camden or near North. In the American Indian community, it's shockingly high. 59% of American Indian adults smoke. And though not as high, the smoking rates are very high among the Somali population as well. 44% of Somali men smoke. Among youth, about 15% of 12th grade youth smoke. 18% of young men are smoking cigars, cigarillos, and little cigars. This is higher than their cigarette smoking rates. And similar to the adult population, American Indian youth are smoking at really high rates, a third of them at 12th grade. And these data come from the Minnesota Student Survey, but we know that many of our highest risk youth in Minneapolis have dropped out by 12th grade. So it's likely that our rates are actually quite a bit higher. The health department is focusing on 3 areas related to tobacco use. Updating our city's smoke-free policy to include e-cigarettes, assisting with smoke-free rental property policies in low-income housing developments like affordable housing that's privately owned, and with Minneapolis Public Housing Authority. And we are working on strategies to prevent youth from accessing tobacco in retail settings. And that's mostly what I'm going to focus on today. So kids are the target market for the tobacco industry. And they target kids because they know if they can get them addicted as young people, that they will have lifelong customers. In fact, the vast majority of adult smokers started smoking before they were 18. And if the tobacco company hasn't hooked them by 18, they usually get another shot at it when young people leave home. In fact, 18 to 24-year-olds have one of the highest smoking initiation rates of any age population. By the time young people are about 26, they've gone from being an occasional smoker to a daily smoker, thus the lifelong customer for the tobacco industry. And what are they smoking? Cigarette sales nationwide have actually been declining. It's probably partly related to policies, taxes, but it's also because cigarettes are being replaced by cigar products. Cigar product sales have increased exponentially, and they are driven by this explosion of cheap, sweet, small cigars that entice kids. In fact, high school students smoke these cigar products at twice the rate of adults. These products, like I said, are targeted to kids. They look like candy. Notice the packaging, how similar it looks to the candy that's right in front of it. Colorful, bright, appealing. It tastes like candy. In fact, just last week, the New England Journal of Medicine published an article that researchers put out saying that tobacco companies are using the same flavor chemical mix that is used in popular products like Kool-Aid, Jolly Ranchers candy, and Lifesavers. There's a rainbow of fruity flavors. The tobacco industry makes these fruity products, 1, because they entice young people, and 2, because they can. Once the FDA prohibited the sale of flavored cigarettes, the tobacco manufacturers created a whole new line, a whole new array of products of these fruity flavors. These fruity flavors mask the true taste of tobacco, kind of that harsh taste, and make them more alluring to kids. They're also priced like candy. You can see here a Swisher Sweet, grape flavored for 69 cents, 2 Black and Milds for 99 cents. Sometimes you can get 3 for the price of 2. They're cheaper because they come in these smaller pack sizes. The FDA requires a minimum pack size of 20 for cigarettes, but no such requirement is applied to these cigar products. And our state's recent tobacco tax applies to these products, but they are so cheap to begin with that the effect is actually pretty minimal. Stores are the key marketing centers for these products. In Minnesota, the tobacco industry spends $450,000 a day marketing tobacco in these stores. Marketing doesn't necessarily mean advertising. In general, it's usually subsidizing the price with deals like buy 2, get 3, or get 5 for the price of 4. And while it is illegal for stores to sell any tobacco products to kids, 33% of our 12th grade boys who smoke report that they got tobacco products directly from a convenience store or gas station in the last 30 days. Like I said, convenience stores and gas stations. These products are everywhere. We did an assessment 2 years ago in partnership with the Association for Non-Smokers of 60 stores in Minneapolis and found that the vast majority of them sold these flavor products. They sold them in single or double packs.
And this was 2 years ago. I imagine that even more stores have them now. So even though cigar products are sort of the major culprit in youth tobacco use, they aren't the only ones. E-cigarettes have emerged on the scene, and by and large, these products are flavored as well, and all sorts, an array of different flavors, fruity flavors, dessert flavors, candy flavors. And while the health effects of e-cigarettes have not yet been determined, hookah and the shisha that's smoked in hookah pipes is decidedly dangerous. And like e-cigarettes and cigarillos, these products are flavored. The shisha is flavored. People who smoke hookah inhale as much smoke in one hookah session as people who smoke 100 to 200 cigarettes. And there's the risk of increased risk of communal diseases like tuberculosis or hepatitis or meningitis just by the nature of sharing the pipe. To address youth tobacco use, the health department is working in 3 areas. We have partnerships with cultural communities that have grants and contracts with us to do some awareness raising in their communities. We are partnering with North Point Health and Wellness to put on a youth tobacco summit in July, and we're working with a lot of groups to engage young people in thinking about this problem and addressing it. Most notably, we're working with the Youth Congress, and I'm going to introduce Evan Barnett, thank you, who is the Youth Development Specialist for the Youth Coordinating Board, who will then introduce young people who are going to tell you about the great work that they've been doing on this issue.
Welcome.
Thank you. Hello. I just want to help familiarize some people who may not be familiar with the young people from the Minneapolis Youth Congress. It's a body of students throughout the city of Minneapolis, comprised of 6 committees: safety, housing, employment, education, transportation, and health. They help advise our jurisdictional partners, Hennepin County Libraries, Hennepin County, the city of Minneapolis, the Minneapolis Public Schools, and the Minneapolis Park Boards. These young people taking time out of their busy school days, finals, and tests to come and be able to testify in front of you guys. So I want to introduce the Minneapolis Youth Congress and Marissa Skelly, who may need some help. She had a little bit too much fun at prom this weekend.
Okay. Thank you. Welcome.
I've been sick for the last 3 days.
Okay.
And I have no voice, but I'm going to try and speak a little bit, and then I'm going to do that. I'm sorry about this.
That's all right.
We can hear you just fine.
Okay, good. Okay, hello, my name is Marissa Skelly, and I'm a senior at South High. I sound like I've been smoking forever. But I joined the tobacco group because I have seen many of my friends start smoking, and I have learned a lot about tobacco companies targeting youth like my friends, and it is very unsettling. Youth are targeted constantly in new ways by the tobacco companies, including e-cigarettes, which are especially luring to kids because we love the technology and the new idea that it's healthier and the flavors as well. But it still has nicotine, and many tobacco companies have purchased e-cigarette companies. I've seen several of my family members die from smoking-related diseases, so seeing friends start is hard to see. It is even harder when I see how accessible tobacco is to young people. I have friends who go out during lunch at school, walk 3 blocks up to the store, and they can purchase a single cigarette underage. And many people also smoke black and milds my age, or flavored cigars. It is much too easy for young people to get and therefore become addicted to tobacco in our state. Thank you. Sorry.
Hello, I'm Ali Franzis. I'm a junior at De La Salle High School. Me and Mude are going to try to speak for Marissa today. She's feeling a little under the weather. I grew up in Northeast Minneapolis, and in as early as 6th grade, I've had classmates who have been using tobacco products. The kids they hung out with initially pressured them, but over time, they were using products more and more, and now they're kind of hooked to it. It's sad for me to know that my friends are hooked on something that is essentially killing them, and it's also so sad to know that they're such young children who had such easy access to these harmful products.
Hi, my name is Mudeh Hamid. I'm a senior at South High School. And tobacco is a big issue to me because I'm passionate about physical education, and smoking prevents you from having a healthy lifestyle, especially if you start smoking at a young age, which affects nearly every organ in your body. There are about 480 deaths every year from tobacco-related, and more than HIV, legal drug use, alcohol use, motor vehicle injuries, firearm-related incidents combined every year. Many U.S. citizens have died prematurely from cigarette smoking. The smallest progress helps. Just quitting for less than 20 minutes gives you a health benefit. If we can help youth quit cold turkey, or even persuade them to slowly quit before the age of 25 or 30, the body would have fully repaired. Living in the Morris and Boston neighborhood, from what I've seen and observed, tobacco companies are making products more and more like candy products, which catch the interest of young youth all over the neighborhood. The biggest thing I noticed as well is that Black and Mild are popular because they're cheap and flavored and last long. Seems to be popular among many youth. Since joining the NYC Tobacco Group, we learned that we have common stories with other youth across the city.
One of our activities was to collect surveys from current youth tobacco users. We found that over 40% of the youth surveyed had first tried tobacco before the age of 14. And almost 20% of these youth said they most often get their tobacco buying from a store.
Another activity we did is store assessments. I looked closely. What surprised me the most is that the products are close to candy, like what you've seen on the slide. And we brought examples to show you. There you go. In our youth survey, flavor and taste was the second common reason for selecting a product. When we shared this information with other adults and youth, that they were both shocked and appalled that they've been tricked this whole time.
Over the last couple of months, we have been sharing our data and having conversations with youth from around the city. We've hosted a youth forum, and we've met with Minneapolis Public Schools Student Council, the North Point Breathe Free Youth Group, and the YWCA's Strong Fast Fit program. And we hosted 2 sessions at the Latino Youth Congress. The issue of youth access to tobacco products exists on the north and south sides and throughout the different ethnic and cultural groups. Groups have been surprised by some of our data, but they also are really familiar with the products and how easy they are to get.
We'll be taking the next few weeks to put together all the information that we gathered and drafting the recommendation based on what we and our peers think will most help prevent the next generation of youth tobacco smokers.
Thank you. But if you do look at those, you can really see how much they are actually targeting youth, because youth, we like candy. That's just something. And
as we get older, it seems like what's next? And that looks similar to candy, so after going towards tobacco is the next step.
Yeah. Well, thank you very much. I really appreciate you coming in here. I think it makes a big impression to have youth, and we really appreciate your involvement in the Youth Congress and then also focusing in on this issue. So as you have time to work on it and come back with some more recommendations, I think we'll really want to hear those and see what we can do as a city maybe to help address this. So thank you so much, and hope you feel better soon. But it was a good trick, though. I don't think anybody's had the council listen so attentively before.
So as I said, we've been engaging youth organizations, and their experiences and the impressions that they're seeing mirror what youth all across the country are experiencing and seeing. So I want to tell you about some of the actions that other cities are taking to address this issue. A number of cities are putting restrictions on where flavored products can be sold. New York City, Providence, Rhode Island, Santa Clara County, the state of Maine have restricted the sales of flavored products to certain types of stores. Other cities and communities have required a minimum pack size. If you'll remember, I said that the cigarillos can be sold as singles or 2 packs. So they've increased the pack size, which then increases the price. New York City has boldly passed a law to increase the smoking age, or the age of purchase, I should say, to 21. And then a number of communities have put bans on pharmacy sales. So with that, if you have questions for either myself or the Youth Congress members.
Okay, I think Councilmember Johnson has a question or comment.
Thank you, Mr. Chair. I just want to say it's very exciting to see the leaders of our city, future leaders of our city here, and to see you involved in these really, really important issues. And I would encourage you, I wouldn't be surprised if one of you is sitting up here, or one of your peers on the Youth Congress sitting up here in, another 4, 5, 6, 7, 8, 10 years. I'm 29 years old, so it's not that far off for you young folks, but I just want to encourage you to continue staying involved, keep pushing on these important issues. You are really making a difference for a lot of people in this city, and I really want to thank you for that work.
Councilmember Fry.
Just very quickly, echoing what Councilmember Johnson said, but also this is more than just a major health issue. I read this study the other day that found that smoking cigarettes, well, smoking anything, was the #1 negative correlation between business or entrepreneurial success. So, in other words, every single time you have to go and smoke a cigarette, some people it's every hour. You have to go outside, you have to leave what's going on in the office or whatever the collaboration is happening inside, and you have to go outside and spend 15 minutes smoking. You miss time, you probably smell a little bit when you come back in, and it doesn't help your lungs, and it also doesn't help your wallet. So really appreciate what you all are doing.
Thank you very much. Councilmember Bender.
Thank you. Ms. Pratt, have you identified some next steps here? Would the team be working on some specific policy changes to bring forward for our consideration? Or, I think there would be interest in that.
Chair Gordon, Councilmember Bender, thank you for asking. Well, actually, the Youth Congress is an important strategy for bringing some policy work forward. Our federal funding prohibits us from directly advocating or suggesting any specific policies. But the Youth Congress will be recommending some strategies, as I did in my PowerPoint, that could be considered by the council.
So you mentioned earlier our Youth Tobacco Summit in July. Was that last year?
No, this coming year.
So that's coming up.
Yeah.
So what I'm expecting is following that summit is when you're going to kind of focus in, you're going to keep doing some research, you've done your survey, you're going to look at what other cities are doing, and then you'll come back, maybe working through the health department, or wherever that would make the most sense, and with some recommendations of things you think we should do first. That's kind of the plan, and this was an opportunity for us to hear about it first. Okay. And it would be great if you could also communicate with our public health advisory group too, and others, so that we can, as everybody's getting, and your youth coordinating board can also be there too to help support that effort too. So thank you very much. But I think today all we need to do is receive and file this report and presentation. So I'm going to move that. Councilmember Bender, do you want to make any other comments? Okay. All right, all those in favor then, say aye. Aye. Thank you very much. And now we'll move on to item 6, which is the presentation of the 2013 annual report of the Public Health Advisory Committee. And no doubt there's a bit of tobacco-free policy work going on here as well.
Okay, perfect. All right.
Welcome. You need any time to get ready, or are you all set?
No, we're set. Good afternoon, Mr. Chair and council members. My name is Karen Soderberg. I live at 286 Washburn Avenue North, representing Ward 7, and I'm co-chair of the city's Public Health Advisory Committee.
Good afternoon. I'm Tara Jensen. I live at 1914 Newton Avenue North, and I represent Ward 5 on the Public Health Advisory Committee, and I am the other co-chair for the committee. And we're here today to present a summary of our PHAC activities and our 2013 annual report. So just to give you some background, I think some the council members are new, so to give you a background of our committee and what we do, PHAC has three main responsibilities: to advise the City Council on matters of public health, review proposed priorities of the Minneapolis Health Department, and to hear and respond to public health-related complaints, concerns, and views of Minneapolis residents. PHAC has up to 20 voting members at any given time, composed of 14 residents and up to 6 other representatives. And the breakdown of PHAC membership is as follows. Council members appoint one resident from their respective wards. One resident representative is appointed by the mayor. 3 organizations submit one nominee representing their interests, and those 3 organizations are Minneapolis Public Schools, Hennepin County Human Services and Public Health Department, and the University of Minnesota School of Public Health. In addition, PHAC may recommend up to 3 at-large nominees for the City Council for appointment. Vacancies currently exist in Wards 9 and 10. However, these openings have been posted in the spring cycle, and applications have been received and forwarded to the appropriate council members. We look forward to having those openings filled in the coming months.
All right, and before I give a recap of our 2013 activities, I just wanted to show you this slide, not just to perk you up with some color, but this is a representation that I like to demonstrate community health and well-being. And really what this points out is that public health encompasses many, many aspects of our society, including many of the various government silos is often how they're referred to. But when it comes to community health, those really can't be silos. It's transportation, it's policing, it's education, it's park systems. Business is roped in. As we just saw, commercial business interests can have a really large impact on public health, as well as social support services. So I just wanted to present this as an important aspect for policymakers and really everybody to understand in terms of what the health department is charged to deal with, even though not all of these areas fall within the jurisdiction of the health department. So our advisory committee, we restructured starting in 2013 so that we meet every other month as a full committee where we usually are acting on something or getting some information. And then the alternate months we have subcommittees that give us a little bit more agility to address issues that either come up quickly or just need a little bit more of a drill down. And so some of our key activities that we've done under the structure is to participate with the department as they went through kind of a new look, a reprioritization of mission, vision, values. And they brought that information to us, and we had a lot of back and forth on it. I think their end result is a really very well-directed vision for a department that underwent a lot of changes last year. We've also done a lot of work, as you saw, the tobacco issues. We worked to promote a tobacco-free campus at the University of Minnesota. There had been a lot of opposition to that, and we sent in a letter of support for the ban to President Kaler and the Board of Regents, and within a week, I think, they banned tobacco use on campus. So we took full credit for that. We were pretty active with the healthy food policies, getting a lot of updates from the Department of Health on those issues. And also, an important thing is every April there's a Public Health Week nationwide where Minneapolis is pretty active in identifying local heroes and just taking a minute, usually every first or second week of April, to recognize all the work that goes on in public health. So in addition to action items, we get learning items almost every full committee session. So we've already heard about the Youth Tobacco Initiative that you heard about today, and we're supporting them completely. We've gotten updates on the Staple Food Ordinance and an overview of what the Environmental Health Division is doing, their role in the department, and you obviously heard a lot from them today. And then another important one is the overview of SHIP, State Health Improvement Plan. They've got a new grant as of 2013, I believe. A lot of activities going on in the city relating to that. And then we also get some outside information. For example, the American Cancer Society presented some information on their latest cancer prevention study, where really they're looking to us to help reach out and get into more, particularly minority communities, to get people participating in their nationwide survey. And I'll let Tara handle the 2014 activities.
Okay. So we'll tell you a little bit about what we've been doing so far this year and then what we are looking towards for the rest of the year. So our highlights of activities so far in 2014 include, so lots of stuff you can see on the screen, and just to highlight a few of them, presentations from the Minnesota Breastfeeding Coalition and the Minneapolis Health Department's Healthy Start program inspired us as a committee to host a panel discussion next month related to breastfeeding initiatives in our local hospitals. This will allow us to learn more about the support that those hospitals provide for mothers and babies and their stance on the principles of being what's considered a baby-friendly hospital. We continue to support healthy food policies like Karen talked about in some of our work last year, and as you can see on the screen. And then this year in particular, several PHAC members helped review and select those local heroes who received awards on April 8th for the Public Health Week. And then other priority topic areas for 2014 include support for regulation of e-cigarettes, as we heard about earlier. And that includes preserving the Freedom to Breathe Act and prohibits the use of indoor use of e-cigarettes. In April, letters with this message were sent by our committee to the Minneapolis delegation, Governor Dayton, and the Health Commissioner. We continue to support alternative forms of transportation which reduce pollution from gas emissions, promote policies and infrastructure that emphasize the complete streets model that makes it easy for people of all ages and abilities to access biking and walking in the city, and promotes healthy living. If some future topics that we look to pursue relate to homelessness, support for senior and elders, youth violence prevention, and mental health and substance abuse. And as always, we remain interested as a committee in and responsive to the concerns voiced by our neighborhoods, our communities, and the City Council. So as we move forward, sort of three major areas that we're heading towards, focusing on now. The committee will support the goals in various divisions of the health department, provide feedback to the staff and leadership. We will be a sounding board for the various programs and initiatives, review previous PHAC recommendations and endorsements, and follow up on the implementation. So, you know, because we want to know what's happened with the things we've discussed in the past, with letters and recommendations that that we've put forward in the past. So we like to do follow-up and know what's happening with that. We want to continue to engage our council members, our community members, and partners in discussions around health concerns and priorities. We really feel that the reorganization we went through last year, or began last year, has positively impacted the work that we do. By implementing this subcommittee structure, it allows us to, when in the rotating meeting schedule, it allows us more time to act on topics as we learn about them, and then just sort of break it down into workable pieces instead of just one big committee fielding all of these things at once. And then the final thing, last year PHAC received 4 new members, so we will add several new members this year as well as those positions get filled. And as a result, the Communications and Operations Subcommittee, we reviewed all of our old orientation materials, came up with new ones, streamlined, and a lot more sort of user-friendly that we will use going forward with our new members. All right, so then moving on to,
That's it.
I think that is it. So we would like to ask if you have any questions for us.
So I have one question, and maybe I missed this. I was interested in your restructuring, and you said you had committee work that gets done every other month. What are there standing committees, or are they special work groups that get started?
Yeah, we formed.
You already said that.
3 committees. One is a policy and planning committee, which takes the most responsibility for identifying and prioritizing the issues that we will either take action on or have a learning session about. We have a community engagement subcommittee, which actually on their off months now, they don't even come and meet. They actually go out into the community, and they are intended to bring the voice of the community to our table. And then the operations and communications subcommittee is actually just the 2 of us. And so we do things like write the annual report up, and we we develop the orientation materials in conjunction with the staff. So it's, and there'll probably be some other issues. It's been in place now for 16 months, and we're kind of testing to see how everything works on that matter. And to give it some context, previously the Public Health Advisory Committee had funds to distribute through community development block grants, and those dried up in 2012. So we kind of found ourselves not knowing what to do, and came up with this plan to restructure, and then as the department went through some changes, it just all aligned nicely to get a new set of priorities, and I think it's given us a lot more breadth in what we pay attention to.
And you've been there through that whole transition, haven't you?
Yeah.
And you've helped lead that, and I really appreciate that and your work and your investment in that, and it seems like the Public Health Advisory Committee is as strong as ever and is moving clearly forward. I really appreciate seeing what you're working on. I have to say that a lot of times I don't think of biking, walking, pedestrian infrastructure and these things as this is something we should bring. I mean, we're working on a protected bikeway plan right now, and I don't think we've ever formally said, could you please provide some feedback on this, and maybe that would be very useful. So we'll remember that, and maybe we'll hopefully base it on what you've at least listed here and won't come up with too much out of the blue. I also really appreciate that the school readiness idea. This is something that hopefully we can build on from the mayoral campaign, and there's this whole idea, I think, a new interest in focusing on the younger children. And so I appreciate that you're also kind of taking a look at that. So this is very good information. Councilmember Bender has a question or comment as well.
Thank you. This was fantastic. I'm so excited about all of these things. But I also really wanted to note the support for breastfeeding moms. And if there are policy changes that we can make as a city, I think that's a high priority for me, from my own personal experience and many of my friends. We don't do a great job of supporting families, working families in our country, I would argue. And so anything that we can do to lead on this, I think is a really fantastic thing for us to take on. And so wanted to commend you for starting with hospitals, but then what else can we do as a city to support this?
Mm-hmm.
Maybe even City Hall could use a little improvements about where people might be able to go to express milk or breastfeed or those kinds of things. Because I'm not sure if there's a lot of alternatives, so that's good. Any other comments or questions? I'm going to go ahead and move to receive and file this report then.
Okay.
And really appreciate the work that you're doing, and we'll definitely be in touch.
Thank you.
And I'm glad that some of us were able to take a little nap and find some things to do to get through the long afternoon. We didn't vote on it yet? I just moved it?
Yeah.
Okay, all those in favor?
Aye.
Anybody opposed? Okay, thanks. Thanks for keeping an eye on things for us. Did you notice that, or did the clerk notify you?
I'm sure.
Okay. Good job. That's what the vice chair is for. I was too excited about this final item. So wake up, everybody. Here we are. This is actually it's an update that the committee requested to get a report back. It might have been that we requested it in April, but here it's almost April. And this is about our animal adoption initiative and expanding the number of pets that we can adopt to the general public. And welcome.
Great. Thank you so much. Chairman Gordon, members of the committee, my name is Jeanette Wiedemeyer Bauer, and I'm a proud member of the Minneapolis Animal Care and Control staff. We brought some guests with you today. We know you've had a long agenda. So we have brought a couple puppies over here. We have Roxy in the white, and we have Bella in the blue. We brought in the corner over here is Prim. Prim is a dog that's alumni from MAC and transferred to a rescue group a number of years ago and is now being raised. We're going to kind of go through a little bit of the presentation. You can stop for questions, no problem whatsoever.
Councilmember Johnson already, since you've invited questions to stop whenever, here we go. And I hope our camera operators are getting on some of these pets too, but Councilmember Johnson.
Mr. Chair, I'll note that the Youth Council did pass around handouts, and I'm assuming that's what's going to happen with these puppies. So if we would be able to inspect them during the presentation, cuddle them, whatever,
Okay.
that'd be great. Thank you.
All
That's
right.
funny.
So noted.
For us today, we're very excited. I think it's always helpful to look at history when you try to reflect on where we are today. 15 years ago, when a pit bull came into Minneapolis Animal Care and Control and did not have an owner, a pit bull, a Rottweiler, some people call it a bully breed or a power breed, it did not leave the shelter alive. You flash forward to 2010, MAC had 16 rescue groups to transfer dogs to, and only a couple of those could take a pit bull or a Rottweiler. Today, 2014, we have 48 rescue groups, and 17 of those individual groups will take a pit bull or a Rottweiler. We were approached by the community in 2012 to start looking at, could we do this? Is this possible for our city? About the same time, we blew out with a new volunteer program. We went from 1 to 100 volunteers in about 9 months period of time. In 12, we started thinking about this. By September of last year, the city council that was in order voted to adopt all animals to the public and for us to start working toward that. December, the key was the funding in the mayor's budget that allowed us to do this. And today I'm very proud to announce that June 5th, the city of Minneapolis will adopt power breeds, bully breeds to the general public. We have just a little bit on the initiative. Just as an overall, our hope is to adopt all animals to the general public. We want to improve the health and well-being of the animals in our care. We want to create timely matches between humans and between the pets so that we can have lasting matches. And for us, efficiency and effectiveness are key to our work. We know we're going to be successful if animals stay shorter time in our care. They're healthier, that when we have unplaceable animals, by definition, that they're not being transferred anywhere. We want to balance the work that we do with our control functions, because we're a public safety entity, with our roles and responsibilities for animals, enrichment, socialization, and care. In terms of our project stages, we are near the end. All we have left for us is to work on making this presentation, and then we have 4 weeks before we launch on June 5th. Marketing, implementation are where we're going next. In terms of your committee and your interest, our community engagement, where it took us, was to 156 people, 152 plus some people who provided written testimony to us in the community. We had 17 focus groups, folks who were animal lovers, people who donated money to us, people who donated things to us, staff members, individuals who owned pit bulls, individuals who didn't own pit bulls, to give us some impact of what we're doing well, how can we improve. So we spent a lot of time between December and early April, end of March, getting the feedback and the barometer of what the community want. In terms of their suggestions, they gave us a lot. They wanted a presence in the lobby. They wanted us to talk with people individually. They wanted same-day adoptions. They wanted us, most importantly, to remove barriers to adoption, because animals deserve to be in homes as opposed to the shelter environment. Education was high on the list. Matching people was high on the list. Training was ultimate, not only for pit bull owners, but for individuals who might be first-time owners. We talked about unprovoked human aggression is unacceptable, and it was nice to hear the community talk a lot about safety and keeping our people and our animals safe as we move through this process. And as you know, MAC may not be known so much as an adoption center, so we got to work hard on marketing so that people in the community know exactly that we have adorable pets like these. In terms of our elements, I'm not going to go through the whole thing. What I'm going to do is I'm going to focus on 4 new elements. We're excited about a new intake exam. Gives us an opportunity to move forward with animals in a great way from the moment they step into the shelter. Looking at automation, looking at volunteers in the shelter doing greeting and educating pet parents, as well as a behavioral evaluation. And so in terms of the animal intake, basically it's the basic evaluation: ears, eyes, nose, paws, being able to get after some of the medical pieces that we want to sooner rather than later so that the animal is better cared for. In terms of our volunteer adoption coordinators, the 2 volunteers we have with us today, Miss Sue has been a volunteer with MAC for almost 3 years, and she will be moving into the role of an adoption counselor. Miss Harmony in the back with Prim is our new volunteer. We recruited 19 new volunteers and 6 existing, so we will have a rotation of 25 individuals helping people make great decisions and encouraging them in their ways, and helping them say, maybe this isn't the right pet for me, so that they will have lasting. They'll be doing education and resource exchanges. We have a couple of volunteers who will be calling individuals on the phone a couple days after they've adopted to say, how's it going? And I think that will be another element of customer service that we haven't been able to get after, and this initiative will allow us to do that. In terms of community automation, it's not as sexy as some of the other topics, but things that animals need, we're developing the report through our software companies so that every morning reports run and we know exactly what needs to be done. There's no going to be losing things. There's no going to be opportunities for problems. An animal stays in the shelter a short amount of time. It's good for the animal because of disease prevention and socialization, and then they're out the door with a new home if we can do that. In terms of the behavioral evaluations, a behavioral evaluation is an opportunity for us to continue protecting the public. Our goal is to identify those dogs with an increased risk of a bite. We want to assess dogs on a known standard of acceptable behavior. And because we're having volunteers in the community or in the lobby speaking with the community, we are having an opportunity for richer dialogue to be able to use the information we've learned in the behavioral evaluations to work with parents, pet parents, to make better choices. When we went out to the community, there were a number, like I said, 152 people we talked with. And these are some of the quotes. In terms of us protecting public safety, looking at an individual, and his quote is, "Life sucks. Living life with an aggressive dog." He has an animal that he can't take out in a situation like this. People telling us not to adopt out aggressive dogs and do not adopt out dogs that have a bite history. So on that side of the continuum, we look at our data in terms of what we do in public safety. In 2013, we had 413 bites or incidents, and of those, 59 were serious bites. We have a total of 313 declarations declaring an animal potentially dangerous or dangerous. So on one side of the continuum, we're highly sensitive to the safety elements of our work. But some other quotes from focus group members are talking about their pit bull as a wonderful member of the family, and I can't wait for you to adopt it out. Talking about their Rottweilers and pit bulls are fabulous pets. And I love the last one of my lughead pit bull thinks she's a lap dog. We have a real job in front of us is trying to differentiate between the safety issues and the dogs like Prim, who's just a bunch of goo on the floor. This is a dog that was an alumni of MAC. This is named Bosco. This is a dog that was also transferred to a rescue group working on canine good citizenship. Really a wonderful animal. And that is why we started this initiative, because animals deserve to be in homes like this young couple. I can skip through a little bit about this, but in terms of where we develop our work, a lot of the work we do is based on science and research, and the standards already out there nationally. I'm going to introduce our behavior evaluation team leader. Dr. Terry Durr has been on with MAC over 2 years. She's a veterinarian in practice over 33 years. She has been, more importantly, in shelter medicine for the last 13 years, and it's been a delight to have her on the team. She has an interest in sheltering and an interest in behavior, and she's helped 3 other shelters before she came to MAC launch this type of behavioral evaluation in the community. So we're very confident that Dr. Durr is leading us and being participant in where we need to go. If you want to step up, Tara.
Hi. Thank you for inviting me. The behavior evaluation that we're going to be utilizing is modified from the Sue Sternberg Assess-a-Pet standards. We took... I was on a committee once at the Animal Humane Society when the merger happened, when all 5 sites came together. We took every behavior evaluation that was out there that we'd all been trained in. We took the pieces that gave us the most information in the shortest amount of time, because time is such a precious resource. That is the crux of the behavior evaluation we're going to be using at MAC. It's based on the evaluation that's been around the longest. Certainly, things keep changing. More information keeps being produced about these tests. It's my responsibility to keep up with everything and utilize all the best information to make our test more robust and more predictive. This is one component of the behavior evaluation. You're going to get to see a video of what a behavior evaluation looks like, but this is from the text that we use. This is how we do it. The head pat evaluation is simply patting a dog on the top of the head, which is a slightly annoying thing to a dog, and then repeating it so that he knows every time your hand comes back, you're going to be patting the top of his head. So the way that it's written is for safety first, tells us how to handle the leash, how to handle the dog. We talk to the dog. This is a training exercise as well as an opportunity to see his reactions. And each dog that gets evaluated is judged according to the same standard. So, thank you. This is difficult to read, I understand, but what this shows you is we have many potential ways a dog can respond to the head pat test. We have sorted those responses into a variety of groups, which allows us to kind of give a sense to a potential adopter, what kind of a dog is this? The dogs who enjoy it, who move closer and want more interaction, are likely to be very responsive dogs and fairly easy dogs to deal with. Those are the green ones. Those green is easy. Dogs who duck away and are shy and fearful but don't show any aggression, fearful dogs are going to be called endearing. And then the blue dogs, distracted, unresponsive, ignore the evaluator, or get mouthy or get active. These are dogs who are high energy dogs. They're going to be adopted out under the label of energetic dogs. So if people want a couch potato, they're probably going to want to choose a green or an orange. If they want to go jogging 4 times a day, they're going to probably want a blue dog. The only way to fail any of these subtests is to show overt aggression, to try to bite. Now, we don't require ourselves to be bitten during the assessment in order to know that biting is going to come. We read the dog's body language. There's a certain stillness, a stiffness, a stare, a curl of the lip, a snarl, a growl, a snap, or a bite. Those are the ways dogs fail. It's not easy to fail these tests. Nationally, and also in the tests that I've been involved with, generally 8% of dogs fail the behavior evaluation. 92% of dogs pass, and that's an important statistic. We don't want to do anything that eliminates good dogs that just need a little bit of work. What we do want to do is identify dogs who are likely to be a bite risk with normal behavior that you would expect a dog to encounter in society. Okay, I've got a very short video. The first one shows the head pat, the touch sensitivity, and the tooth evaluation, the 3 provocative tests that we do. This is me doing the head pat test on a dog named Shazam. I'm just patting the top of her head, stopping, and then doing it again. This is the touch sensitivity test. I'm petting her, I'm touching her, I'm not hurting her. I'm not pulling on her tail so hard that it hurts. I'm just kind of twisting her skin, just plucking at her a little bit. Now I'm doing the tooth test. The tooth test, you lift up the lips for 5 seconds, let go, reward the dog for being wonderful, and repeat 5 times. Remember, the dog's rewarded for the right response each time. Dogs enjoy the behavior evaluation. Sometimes this is the most touching they get when they're in the shelter. During the entire exam, the examiner is reading the dog's body language. Okay, Shazam is kind of an interesting mix of timid and crazy. You saw her do this. That is not a bite. That is not a fail. That's a dog who wants me to let go of her mouth. Okay, she passes. We test for resource guarding by giving dogs a mixture of canned food and dry food. I like doing it on a paper plate so I can see every muscle in the dog's face so I can see their expression. And we take the famous fake hand, the assessa hand, and compete with the dog for its food, even try to push it away, because people do that. When you drop something on the floor and your dog's down there, you push him away with your hand. So we want to see what kind of a response we get. This one is very important for a trusted handler to hold the other side of the leash, but not hold it so tight that it interferes with the dog's ability to get to the food. Shazam became still. Did you get that sense where she kind of quit moving? But she didn't stiffen, okay? And that's it. The test itself takes less than 8 minutes once you've got everything all set up. And once again, the concept is to uncover a dog who is likely to bite in a normal life situation. Thank you. you.
So I guess my question is, what happens to the 8% who fail?
We euthanize them.
So as we launch this initiative, I think it's important to kind of get a scope of the MAC staff. There's almost 150 years of animal handling as animal control officers in our building. We have over 40 years of managers as animal control managers, and nearly 60 years of veterinary care of the 3 contract vets that we work with. So we're pretty excited about the direction we're going into and the direction we've come. These are the little ones that the siblings of these 2 that are here. They will be up for public adoption on June 5th, and they are in foster placements in the evenings right now with staff. They're getting socialized during the day by volunteers, which is important for them to learn that normal puppy behavior. And then next week they'll go home overnight for a permanent temporary 2-week placement, and then they'll come back to the shelter on June 2nd. They'll get their vaccinations, all the microchips, rabies, and then be up for adoption on the 5th. So with that, that's the end of the presentation if you have any questions.
Committee members, any questions? Comments? Councilmember Johnson?
Thank you, Mr. Chair. I know some people were asking first off about the dog Ladybug, and I just want to say I heard that this dog was not euthanized and has been adopted. Is that correct?
Yes, social media is a beautiful thing. That was a false report. The dog is now in a rescue group.
Excellent. That's great to hear. One of the things I know we had talked about, and I was wondering if there'd been any more discussion on this, is about putting these behavioral evaluations online. Since we have to save the videos anyways, they're already going to be open for people to get through data practice requests. And by proactively putting them online, it will show people the great work going on at MAC. Also, they can see basically all the different types of behavioral evaluations taking place, and then allows us to really be fully transparent with the public.
I think if we can figure out how to do it, we're going to. We're certainly going to go ahead with taping the behavior evaluations because it's such a rich learning tool for those of us who study this kind of thing. I think it's just going to be a question of getting our ducks in a row in terms of the technology.
Excellent. Thank you. That's very exciting to hear. And then I also know Chair Gordon mentioned those 8% that are euthanized that don't pass the test. Have we thought about in cases where there might be a rescue that would then have access to that video and they see it and they feel like, yeah, maybe we can work with this dog? Have we talked with legal about doing any sort of release or waiver that says, just so you know, this dog failed the behavioral eval, you're really taking a leap here. What do our rescue organizations think about something like that? What do they feel when it comes to dogs that fail this behavioral exam and potential opportunities to get them into an environment where they would actually manage to work out?
We've not talked to legal. We haven't really investigated that. My recommendation to MAC is to not go down that road. The dogs who do not pass this assessment are dogs who, unless they're handled basically by professional dog handlers, are at great risk of harming somebody at some point. Professional dog handlers don't want these dogs. We know what it takes to keep the world safe from dogs like that. Most of us want to go home to a nice, normal, quiet dog because we're dealing with other people's aggressive dogs all day long. It is not outside the realm of possibility. I know there are rescue groups who want all dogs that potentially will fail. My understanding at this point is that MAC is committed to honoring the test, which means dogs who fail the test are unplaceable and will be humanely euthanized. That's where I understand we stand right now.
And just one more follow-up question with that. So, I mean, is it the environment that might influence any of those factors? Obviously, a dog that has an owner that they get to know and they're in that environment and they adjust and they change their behavior and they feel comfortable with that person and it's a good fit in that regard. I mean, I'm sure those dogs won't be snapping at their owner necessarily when they're in an environment, though, where maybe they come from a stressful situation with a abusive owner, and they've been neglected, and now they're in this very stressful environment with a lot of other dogs barking, a lot of strangers that are now touching at their mouth and their teeth and stuff like that. I mean, is there a second chance kind of opportunity for those dogs, or is there any environmental influence and kind of influence of the history of where they came from that gets brought in with them into that test and their reactions that if given the right environment for a certain amount of time, they would no longer essentially fail that test?
The test is designed to be given in shelters. Shelters are by nature stressful environments, but they're not nearly as stressful as the environment you just described, with dogs barking all the time and strange people touching your mouth. That doesn't happen when a dog's in a shelter, except for when we're doing the behavior evaluation. Okay? Yeah, dogs are barking. They're barking because people are walking by. They're going to feed us. We're all excited. We're going to bark. Or they're going to take us for walks. We're all excited. We're going to bark. But when nobody's in the runs, the dogs don't bark. Our dogs can't see each other. They're resting comfortably. Our shelter environment is a reasonably, I'm not going to say stress-free, but it's very predictable to dogs. And dogs love being able to predict what's going to happen. We can handle a lot of aggressive dogs very safely in a shelter environment. But now we're putting our hands on a dog. We're putting our hands on a dog like your 6-year-old son will put his hands on the neighbor's dog. And if your neighbor knows how to manage that dog so that it won't bite, but he doesn't happen to be there, he just turned his back because his 4-year-old just got stung by a bee, and your child gets bit in the face because the person who can handle this dog isn't right there. Those are the kinds of dogs we're trying to keep out of the community. There are plenty of other sources for those bad dogs. Mac is not going to be one of them.
Absolutely.
Sorry, I'm on my soapbox.
Well, thank you very much for the answers, and I appreciate all the work that has gone into this initiative and the outreach and all the partners that were involved in making this happen. And as well, you know, I don't know if it gets recognized all that often from the council, but all the volunteers who help supplements the work at MAC and make it possible, and the staff that work with them, and continue that effort to really help our dogs in the city. So thank you.
Thank you. I also really appreciate the presentation. I really appreciate hearing the date of June 5th, too. I noticed that was a big announcement. I think this will definitely be something to move forward on. I do have a concern about that 8%, and I also have a concern about the age of the dog. You know, I've raised a lot of dogs, and I know that they learn how to control their nipping and their biting over time. So is there a age at which this test wouldn't be considered effective, or is this?
The test is given after 8 weeks of age.
Okay.
We do understand about puppy nipping and puppy mouthing and puppy biting, and that's taken into account when the test is administered. There is no maximum age, and MAC will be adopting out old animals. There's no upper limit to what we would adopt out.
I think one of the things that's going to be key to the success of this is that we have the confidence of the wide spectrum of animal lovers throughout the city. And so I think people will probably question the behavioral evaluation and have issues with it. And I think that I'll be receptive if somebody thinks there's some therapeutic effort. I understand that you're saying that there isn't necessarily. If you fail the test, it's not worth any kind of, you know, chemo, behavioral, cognitive, you know, psychoanalytical therapy, but I think we can be open to that, or not in the end. But I think at this point, it's exciting that we're moving forward with the program. I really appreciate all the work and energy that went into this, all the focus groups, all the volunteers that we pulled in to help do this. I just hope it's an enormous success, and maybe when we hear about it, we find out that really we're adopting out closer to 98, 99% of the dogs that ever come in and come through, and other animals as well.
We will be reaching out for marketing and advertising and putting blips in your e-newsletters, so look for that. If you can help us anyway in telling the community in your wards about it, we would appreciate it.
Well, very good. And my assumption is then this won't be coming back to the committee before the 5th, of course, and maybe we'll get to hear about it more in a few months after we've seen, or 6 months or a year, or, you know, we can then check back in and see how it's going. And I think it will be important for community folks to weigh in and also let us know what they think about this effort. Hopefully we'll get lots of kudos. All right, thank you so much. And I will move to receive and file this, and I will take a vote on that. If there's any discussion, I'll wait, but I see none. All those in favor say aye. Aye. Any opposed? All right, well, that motion carries. And I believe we have exhausted our agenda, and it was a great meeting. Thank you, everybody, for your attention.